I call upon now Dr. Devang Angmu for his paper on virology and cytological changes in tears and conjunctiva of patients with COVID-19.
A very good morning to everyone, faculty on the dais, and to all my colleagues. I would like to thank AIOS and Chief AFP Center for letting us, allowing us with this study. So the title of the study is Evaluation of Coronavirus in Tears and Conjunctival Secretions of Patients who are tested positive with SARS-CoV-19. And to introduce, we have seen that there have been many studies that have shown the presence of SARS-CoV-2 in tear samples and conjunctival swabs, and they have been in various ranges from 0 to 24%. In our study, we wanted not only to analyze tears and conjunctiva for the presence of the virus, we also wanted to see the study accompanying any morphological changes in the conjunctival epithelium and to identify the viral nucleocapsid protein within the epithelial cells immunohistochemically as a means to document active viral replication, a study which has not been done till now. So it was a pilot longitudinal study because it's the first of its kind, and we had taken 40 cases and 10 controls, and ocular samples, that is tear and conjunctival swab collected in the viral transport media was taken. This was the scheme of the study. We had taken COVID positive patients from the ICU, and tears and conjunctival swabs were collected from the eye. And thereafter, they were transferred into the viral transport media and transported to the virology lab for the RT-PCR. And on the other hand, we also prepared smears and transported into screw cap bottles for cytomorphology and immunohistochemistry. So the patients underwent tear and conjunctival sample analysis, which was done at day 1 to 4. The second sample was taken from day 5 to 7, and the third sample was taken day 10 to 14 to see any tear and conjunctival swab for RNA isolation, and also to see the conjunctival cytology that we had studied. So for conjunctival swabs, we had used the conjunctival flock swab rather than the Schirmer's strip, and these swabs are much superior in detection for the same. So coming to the results, we had enrolled a total of 73 consecutive patients. However, out of this, only 41 cases were included for analysis. Patients, because of our inclusion criteria, we had included patients whose respiratory samples were tested positive from our own lab to avoid any other analysis deviation, and we also those tested by CBNAT or any other lab, we excluded all those patients. The median age of the patient was 48 years. The male is to female ratio was 2:1, and 22 patients were classified to have as moderate disease, and 19 patients were having severe disease. Out of this, only one patient reported ocular symptoms, which was a case of bilateral chemosis. And out of the 41 samples that we have tested, the tear swab samples were positive in 6 out of 41, that is approximately 15% of the cases. And 3 conjunctival swabs were also positive, which is around nearly 7%. And these 3 amongst the 6 whose tear swabs were positive. And all our repeat samples, they tested negative for viral RNA. So out of the 41 samples taken, the samples of only 30 patients were adequate for cytological analysis. So in the cytological analysis of the cases, we saw that there was a lot of neutrophils present, nuclear enlargement, binucleation, multinucleation, nuclear membrane irregularities, suspicions of inclusion as it is seen. However, of the controls, we could see that there was no signs of inflammation and they were uniform nuclei. So immunohistochemistry was possible only in 30 cases, and only a single case revealed positivity for SARS-CoV-2 nucleocapsid protein in the squamous epithelial cell, that is the case 10, the figure of which was depicted. And interestingly, the tear and conjunctival swab for RT-PCR assays were positive in this case with severe disease, and this patient had the lowest CT value, indicating that it had a high viral load in the tears as well as conjunctiva. The remaining immunostained smears from patients and controls did not reveal any immunopositivity in any of these cells. We did have a limitation of having a relatively smaller sample size and inadequacy of few samples. In some cases, the follow-up samples could not be collected either due to the death of the patient or transfer or of discharge. So to conclude, the viral RNA was detected in nearly 15% of our patients. The conjunctival smears from patients with COVID-19 revealed cytomorphological alterations even in the absence of clinically significant ocular infection. However, viral proteins were demonstrated within the epithelial cells only rarely, suggesting that while the conjunctival epithelium may be a portal for entry, viral replication is possibly rare or it is very short-lived. Also, the ocular surface secretions can also be a potential source for diagnosis with high specificity, albeit low sensitivity, especially in the early period of the illness. And despite rare ocular manifestations of the illness, the inflammatory alterations indicate that virus does infect the epithelium that can have implications in the long term as a potential for dry eye disease or any form of ocular surface problems. Thank you.
Thank you, Dr. Deva. I just one question, why there was less controls?
Ma'am, controls, ma'am, basically we had taken controls only to see for the how it was relative to the normal. Ma'am, doing all these immunostaining, it is very costly. So if we were like, at least we see in 10 patients and see if, you know, if it's significant. If it is significant, we might recruit more. But in all of the 5 patients that we have seen, nothing was significant. So that's why we couldn't do because of the limitation of the funding.
Okay, thank you.
You have taken sequential swabs.
Yes, sir.
In all of them, all swabs were negative?
Yes, sir.
Or they were dependent on the treatment?
Yes,
different
sir.
Treatment?
Yes, sir. They were on different treatment while they were admitted.
So can you conclude that ocular surface offers better resistance?
So I won't
Why
say...
you could get so less samples positive?
So that
7% and 14%.
Yes, sir. So basically it was 14%, and if you look in the world literature also, the range is, a couple of studies have saying that they have 0%, few studies have ranged from 7 to 14%, and one study has shown only 20%. So the ocular infection is lower as compared to the pulmonary findings that they were positive on the nasal swabs.
Good study.
Did you give any local antiviral treatment other than systemic treatment?
No, sir.
And still took the swabs?
We did not give any local antiviral treatment, only systemic treatment that was going on, and symptomatic treatment. If the patient had some dryness or something, artificial tears were given, otherwise no other treatment was done.